Hey everyone, welcome back. Den Mother Amanda. Yeah, I'm gonna do this transgender and transsexual, the medical form of it, and what is transsexual and transgender. Are people transgender, transsexual without having to go through a medical transition? Um, we're gonna go into a lot of different, hopefully a lot of different things on this and see where it goes. Okay. One thing that does not change is biology. When somebody does a medical transition, biology does not change. Okay. I prefer to call myself transsexual. Yes, I could fall into it as being transgender, but more transsexual because I'm going with doing the medical route of medical transition. And transgender people do the same thing usually. I say usually because there's a lot of people that are identifying as transgender who really are not doing a medical transition, and it's kind of questionable, whether they're actually trans or not. They may have a different a different gender presentation and not be trans, and that's cross dressing, and it's okay. There's nothing wrong with that. It's what it is. It's cross dressing. Um, okay. Something else. One thing that does not change is your biology. Biology does not change. No matter what you're doing, it doesn't change. Medical science is awesome, and it really is. It's great. They've come a long ways in the last 50, 60 years or even longer. They've come a heck of a long way on being able to do things for people medically, especially medical transition. Um, People say that sometimes I've heard people try to say that when you're changing the primary hormone, you're changing biology. No, that's not changing biology. That's changing the dominant hormone in the body from one to the other, from male to female, changes from the primary being testosterone to the primary being estrogen, and opposite for trans man, where it'd be estrogen was the primary, now it's testosterone. Okay, that does not change a person's biology. What it does change is a person's appearance. Okay, and that's what it changes. That's usually the goal for trans people that are really trans, is trying to change their appearance. Okay. Um, First said that going trans man is a little bit simpler and easier. I don't know if it's simple, but it seems to be a lot easier because the facial hair grows, and on either one, some of the facial features change. And that's part of what's going to happen when you take cross sex hormones, the opposite hormone. The appearance is going to change. The soft tissues are going to change and they look a little different. Okay, there's also facial surgeries that can come with that, masculizing surgeries and feminizing surgeries that can come with facial surgery for transgender and transsexual patients and people. Okay, it just depends on what route you're going. Okay, there's top surgery, which would be the chest. Okay, there's two different types of top surgery. One's breast augmentation for male to female. To give a more, I guess, a better pronounced look of better breast development. Okay, and from male to female, it's a mastectomy, the removal of breast tissue. to make the chest look more masculine. Okay, and some changes like that are visible, easily visible. And oh god, it's just some of the things that also changes is well, backtrack a little bit, try to trans male to female, sometimes we have feminine characteristics that we have put along on the side or shoved aside or haven't shoved aside because it wasn't the life that we were living at the time, was being coming out and being outwardly being trans, or outwardly trying to appear as the opposite sex, not be outwardly looking as though we were trans. We want to look like we were born that way, the best that we can. And like with male to female, a lot of it's facial hair removal. Sometimes it's chest and body hair removal, electrolysis or laser. Okay. There's a lot of us that are out there taking a medical transition that just identify as being transsexual, because it seems to be that transgender has been picked up by so many things that transgender really is not. Okay. Non-binary is exactly what it says it is. It's non-binary. Now trying to present neutral. Okay. I haven't gone down that route. Okay, so how that's a lot of that works out. Well, I'm going to try not to speak on that much because I don't have a lot of knowledge on that. And something that I'm probably going to look into more, research or more, so I can get more knowledge on what it is that non-binary goes through for what they do. Okay. And going to non-binary is not a going from one to a neutral is not a transition. It's to look neutral. A transition is to look like the opposite. Okay, and I have no disrespect for anybody that's non-binary. I really don't. There's a lot. I've got a lot of close friends that are non-binary. That are great people. They really are. God, and there's just so many people out there that are just spreading information out there that just sometimes isn't correct. Okay, I don't see it as much as I used to. Like trans women will say that they'll have a monthly cycle. No, trans women do not have a monthly cycle. Trans women are males. We're not born with a uterus. That's mandatory. It's part of biology. I know. Trans or male. Okay, and as I said before, trans women, even though we're medically transitioning to appear the opposite, we're still male. Our biology is still male. That's a fact. Okay, fact for trans men. They're still biologically female. That's still a fact. Okay. There's a lot of experiences for me being a trans female, a trans woman. I don't have a lot of the experiences biological women have. I don't have. I'll never have because it's just impossible. Because biology is a fact. Okay, because was not born with a uterus. I was born male, no uterus. I'll never know what it's like to be pregnant. I'll never know what it's like to have a monthly cycle. I'll never know what it's not going to happen. Now, can I have some of the emotions that women have? Yes, absolutely. Some of those, we're all born with varied emotional traits. Okay, usually when males are born male, their traits are predominantly male with some female traits, and it's opposite for females. They're born with their female traits, characteristic traits, and some very few are masculine. Okay, and that conversation can go on a whole wide range of other directions too, but that's not where we're going to go with that right now. Okay, being trans is definitely a medical process. Okay, transitioning to appear is the opposite. Okay, gamut of surgeries for like male to female. There's facial feminization surgeries. Okay, where the brow bone can be shaved down. Okay, this could be smoothened out up in here a bit. The hairline could be brought up for a little bit farther. The jawline can be brought down into more of a V, and the chin made smaller. Okay, being trans, whether it's a trans woman or a trans man, it's never going to change. It never will. I can't say it never will. Someday, human science may figure that out someday. I don't know. They said there's a lot of good biologists, a lot of good doctors, a lot of good people working in science and medical science. How long out that is, I don't know. Maybe it never will. I don't know. Maybe it's something in the future that can happen and still be researched on for those who really feel deep down, like myself and others, really feel we really wish we would have been born the opposite. I really wished I would have been born female. The fact to deal with my life the way it is. I was born male. So what are my options? Okay, take estrogen. Okay, and increase my estrogen for my body to assimilate to look more of the opposite. There's also surgeries. I said before, top surgery, bottom surgery, facial surgery. Okay, facial feminization surgery from male to female, facial masculinization surgery for female to male. Top surgery, which is chest surgery, double mastectomy for female to male, and breast augmentation from male to female. Okay, bottom surgery, male to female, is penile. Okay, to make it look like what I've seen, it seems to work pretty well. It looks almost virtually natural. Surgeons are really good at it. Um, Same with breast augmentation, facial surgeries, and it's still more. It's and the surgeries are getting even better and better. And I think that's with more experience and more training and oh god, one thing else too that is for to be trans is having gender identity disorder or what's now more referred to as gender dysphoria. It's a discomfort with the sex and gender that we were born as. Okay, and it's there's nothing wrong with that kind of mental illness. There's therapy we can go through, mental health therapy, and if we're going to go through a medical transition, that's something that we need to do to begin with anyway. If people are going to consider medically transitioning and altering their body, it's required, and I agree with that because who knows? I might have found out in the process of having therapy before I started hormone therapy in this process of medically transition. And who knows? There's something may have come up that may have changed my mind, or it may change someone else's mind. Okay, and then learning ways to deal with that if that's the case. Okay, and or if a medical transition is not optional surgeries. If that's not optional for the person, that could be hard to deal with for somebody who has gender dysphoria or gender identity disorder. It can be hard for somebody to deal with if they surgically transition. Working with a therapist is good, and support support networks. Okay, for people who are trans. Okay, especially those who are trans and can't, for whatever reason, medically transition. Okay, it's a struggle. It can be a struggle even being able to medically transition. With cross sex hormones and surgeries. Surgeries are not easy to all easy recuperation process. It's rough. It's tough. There's a lot of pain on the other side. And no matter what surgery you're going through, if you've had surgery before, you know what I'm talking about. It's difficult on the backside of surgery. And not everybody that says they're trans is trans. Maybe they're just cross dressers. Maybe they have autogynephilia. And I forget there's a female name for that as well. I forget the name of it, the exact word that is used for that. It'll come at some time. It doesn't mean a person is trans, although they could be, and have a medical transition. Not always. Okay, so autogynephilia is something where men want to dress as women. There's nothing wrong with that either. There's nothing that's good cross dressers. Now look at how many shows are out there where like RuPaul's Drag Race and other drag shows that are out there. There's people, men and women cross dressing for entertainment, and not only just entertainment, just because that's how they feel comfortable that way. They're not. That's not trans. That is just appearance. Okay. Um, Transgender was supposed to replace the word transsexual. They mean exactly the same thing. When somebody is going through a medical transition. Okay, and a lot of there's a lot out there that claim to be transgender and just cross dressing and claiming they're transgender. Okay, they're just changing the position of their gender. Okay, that's where some of the meanings can kind of get a little skewed. Okay, that's why a lot of us are going back and referring to us as transsexual because that's what we are. Is we're transsexual, we're transitioning our bodies to appear as the opposite. Okay, there are people that are claiming to be transgender that are doing that as well, but claim to be transgender. Valid too. Was meant to be originally was to replace transsexual. And it's gotten into this broad scheme of things that what are you talking? Does anybody really? Well, what it was supposed to do is replace the word transsexual. Is what it was supposed to do. Okay. I heard quite a few years back, they have done uterus transplants for women, and they were kind of trying to. And I heard that there were ideas on whether they're doing this or not, or looking into it or not. What uterus transplants for trans women, whether they're still doing that or not, or looking down that avenue or not, I don't know. I just don't know. They very well may be, but they may not be. Okay. Can some of us be gay or bisexual? Yes. Or lesbian? Yes. And lesbian would be the trans man, and gay would be the trans female, the trans woman. Bisexual would be either one. Still have to be a woman to be a lesbian, and trans men are still biologically female. Gay men, our biology is still male. So before, all we're doing is changing our appearance. That's all we're doing. Seems like there was some other things I was going to bring up in this too, and I'm just not thinking of it right offhand. And I'll probably do more on this topic down the road again. Any questions, ideas, comments? Leave them in the comments section, and I'll go through them and see what happens, see what comes up. And there's things I had on my mind that are just slipping, just aren't it isn't there anymore, and that's okay. We all have those moments. But there seems to be a difference between transsexual and transgender. They can overlap because transgender doesn't mean what it was supposed to. Does it cover what it was supposed to? Some of it, yes. Transsexual is what we're doing is we're changing our physical appearance of sex, and we're changing our gender mannerisms to fit the direction we're living our lives. Me, trans female, medically altering my body to appear female and trying doing the best that I can do is present in my mannerisms as feminine, female, as much as I can, best that I can. Vice versa for female to male, doing the same thing. And remembering that we all have varied traits, varied personalities, varied ways that we interact with people. Okay? It's not a 100% set in stone thing. It's like I say, we all have varied traits. Some females have masculine traits that show. Some males have female characteristic traits that show. And I think that's just a part of life. And, but anyway, leave comments, questions, ideas, in the comments section. So please subscribe, and if you would, please like. Helps get my content out. And maybe we'll do some more on this. All right, have a great day, no matter what part of the day you're in. Bye for now.